417 into 2. Yes, it's clear?
Can you explain again?
Yes. So drug A has been given for 10 hours. Drug A has been given for 10 hours, which is a chemotherapy infusion. And drug B has been given for 2 hours. Drug D has been given for 2 hours. So as I have said, it is a chemotherapy infusion. So that it comes under the code of 416 as well as 417. You can see here, initiation of prolonged chemotherapy infusion. So what is the time as I have given for drug A? 10 hours I have told, right? Yes? Yes. So that the code will be 416. If it goes more than 8 hours, you can pick the code of 416. Okay. So drug B, how many hours I have told for drug B? 2 hours. 2 hours. So for that you can use the code of 417 into 2, which is each addition sequential infusion, different substance or a different drug, which should be for up to 1 hour. As I have said, it is a 2 hours. So you will be using 417 into 2. Is it clear? Yes. Yes. Okay. So that's what I have told on the concepts now. So primarily you will be coding for the infusion, IV push, and then for the hydration. So in this also, the chemotherapy has been given for a high dollar value and followed by for the therapeutic. So the chemotherapy or the codes which is now we have seen, and therapeutic denotes the codes which we have seen already on the infusion, hydration, and intravenous push. Is it clear? Yes, sir. Okay. So apart from that, the moderate sedation is on pending, right? For you all? Rest of them are completed. Okay. So what do you mean by moderate sedation? Sedation. What is the use of sedation or sedatives?
We do surgery sedation to keep the patient from pain free.
That is a pain management. Okay. So the pain management is denoted as moderate sedation. Okay. Due to a surgery or due to any condition, the patient may have a pain in the body part or in the pain in the anatomical set. Further, the patient will be given a sedatives, which is called as moderate sedation, which is a pain management program. Okay. So in pain management or in a moderate sedation, exclusively we do have a 6 codes over here. This is a only code for the moderate sedation. Apart from that, we don't have any specific code for the moderate sedation concept. So there is a difference between 99, 151 and 155. You can undergo and find the difference. That's where we all lag. Find the difference between 99, 151 and 155. I will give a time. Yes. Tell me 151 and 155. Someone has told. Same physician.
Same physician or by
That's so good. So 151, the moderate sedation has been given by the same physician who is undergoing the treatment or the diagnostic procedure. Okay, I will explain here. Moderate sedation service provided by the same physician or other qualified healthcare professional performing the diagnostic or therapeutic service. That is the meaning is the doctor is undergoing a treatment service. The same doctor itself has been given a moderate sedation so that you can pick the code of 151, 152 and 153. Whereas 155 is for the moderate sedation service provided by the different physician. That is provided by the physician or other healthcare professional other than the physician or a healthcare professional performing a diagnostic or therapeutic, which means the moderate sedation has been given by another physician and the treatment is undergoing by the different physician, so that you can pick the code of 155. Okay, 156 as well as 157. These are the time-based codes as well as age-based codes. So this 151 is for the initial 15 minutes of services for the patients of younger than 5 years. Okay, so whereas 152 is for the initial 15 minutes of intra services for the patient of age 5 or elder than 5, that is older than 5. So that the code will be 152. So if it is younger than 5 or elder than 5, if it is goes more than 15 minutes, you can use the add-on code of 153. Okay, so now let me tell. The patient is undergoing a moderate sedation by the same physician. The age of the patient is 16 years. Age of the patient is 16 years. And the total time spent is 30 minutes. 30 minutes. What will be the code?
99152 and 99153, ma'am.
152 as well as 153. As I have said, the moderate sedation is given by the same physician. So it comes under 151 category, right? In that I have told the patient age is 16 years. So it comes under 152 category. That is age 5 year or older, 152. As I have said, it is 30 minutes. For the initial 15 minutes, the code is 152. For the next 15 minutes, the code is 153, which makes it 30 minutes.
The codes 99151 and 152 has that 51 exemption modifier symbol, ma'am.
Add-on codes has a 51 modifier exemption.
Even 99151 has that, no, ma'am?
Yes, we do have. Usually, we should not append for the add-on codes. Modifier should not be appended over there. Okay.
So what are the add-on codes?
Yes, add-on code should not use a 51 modifier, 50 as well as 51 modifier exemptions. Usually, we should not append modifiers with the add-on codes. We will be using with the primary codes. Okay. Yes. So this is all the codes. 155 basic code. Okay. Younger than or 5 year, age of 5 year or older. If it is younger than 5 year or elder than 5 year, if it goes more than 15 minutes, you can use the code of add-on code 157 for the each additional 15 minutes. Okay. Now tell me, the patient has undergone moderate sedation by the same physician. The patient ages 3 years. Patient ages 3 years. And the total time is 45 minutes. Total time is 45 minutes. 152 and 153 into 2. So that is 151 is for the initial 15 minutes, younger than a 5-year age. And as I have said, we do have addition of 30 minutes. As I have said, it's 45 minutes. So we do have addition of 30 minutes. For that, you can use the code of 153 into 2. Okay. So this moderate sedation codes can be asked directly. Okay. You can directly either code on this concept. Sometimes they will be given with other series, like a 3 series with this moderate sedation code, 5 series with a moderate sedation codes. It can be either given in a combination scenarios with the other series, or it can be directly asked. Okay. In this moderate sedation, you will be having at least one code. At least one question will be there on moderate sedation concept. Yes. Any doubts on the moderate sedation, guys?
No, ma'am.
Okay. So, one more thing I need to tell is, okay. So, one more thing I need to tell under the medicine, the important areas over the medicine concept. First one is vaccination. You have seen below 18, above 18 criteria. Do you remember? Below 18, above 18.
Yes, ma'am.
Intraoral use, intravenous use, counselings, you have remembered, right? In that you will be having a one question, which is a very important area. Okay, vaccination. And next one is from the psychotherapy. Psychotherapy. And psychotherapy with E&M. Psychotherapy with E&M. The entire psychotherapy concept. It can be psychotherapy or psychotherapy with the E&M or psychotherapy with crisis. That is psycho crisis. Psychotherapy with crisis. These three concepts. And next one is dialysis. Dialysis. Home dialysis. Full month, less than full month. You remember, right? All these concepts.
Yes.
Yes, dialysis is an important area. And next thing is on this infusion, hydration, IV push. Infusion, hydration, IV push. And next one is moderate sedation. Moderate sedation. These are the very important areas because we do have a numerous guidelines over there. Based on that, you will be having, in this concept itself, you will be having 3 to 4 questions for the examinations. Okay, minimum of 3 to 4. Okay, once again, I'm repeating: vaccination, dialysis, and next psychotherapy, moderate sedation, and then IV push, hydration, infusion. Okay? Yes, if the moderate sedation has been completed, your portions got completed, right? Under the medicine. Medicine topic has been completed for you. Let's move for the ENM part. Okay, I will give a general revision over the ENM and then I will start on tomorrow. Okay, to the course I will start on tomorrow. Now let me give a general ENM revision. Okay, so what do you mean by E and M? E and M?
Evaluation and management.
Evaluation. What do you mean by evaluation? Yes. What do you mean?
Analyze.
To evaluate or to diagnose the patient. And various management. What do you mean management?
To providing suggestions for whatever evaluations we have concluded.
Yes, there's a treatment. Okay. Yeah. So evaluation denotes the diagnosis and management denotes the treatment, which we call it as evaluation and management. Yes. So this ENM is a very important area for the examination point of view. Some candidates, not some, a lot of candidates will be facing the difficulty under the ENM part. Okay. So if it is not given directly, you will be facing the difficulties over the ENM part. Okay. So coming